Um, so I will introduce our speakers for today, and if you have questions, feel free to post them in the chat box. As I had mentioned earlier, one of our speakers has to leave at 12:30, so we'll make sure that if the questions don't get answered today, that we can follow up and get you those answers. So with that, I will go ahead and get started. Our first speaker, Karen Stallman. She is a double alumna of SIU Carbondale. She earned her Bachelor of Science degree and Master of Science in Agricultural Education with a minor in Animal Science. She worked 20 years with the U of I Extension in Randolph County, including a decade as unit leader and earlier as Youth Development Extension Advisor. Karen also served as the director of the Sustainability Initiative and vice provost of the Red Bud campus at Southwestern Illinois College for 9 years. Karen also served as director of continuing education and outreach director at SIU Carbondale for 6 years. Today, she's the agriculture resource specialist for the Farm Family Resource Initiative, managed by SIU School of Medicine Center for Rural Health and Social Service Development. She and her husband farm in Randolph County, where they raise corn, soybeans, wheat, and beef cattle. Our other speaker today, Adrienne DeSutter. Some of you may have met her earlier. We had a previous webinar, so we're so glad to have her back as well. Adrienne is part of her husband's 4th generation farm family in Midwest Illinois. They farm corn and soybeans with a small herd of cattle and a small herd of children. With a master's degree in counseling and self-proclaimed master of farm family chaos, Adrienne recognized a need for mental health advocacy in agriculture and began partnering with ag businesses and organizations to promote healthy minds and prevent farmer suicide. In addition to public speaking, Adrienne helps create and connect valuable ag mental health resources, writes a wellness column, and has been featured in articles, podcasts, and initiatives across the globe. She encourages a community approach to keep farm families healthy and works to break down mental health barriers and empower farmers through her social media presence at Sow Hope Grow Hope. So with that, welcome to both of our speakers. Thank you so much.
Thank you so much, Jody. We are delighted to be here. Mental health is something that Karen and I are both very passionate about. And while it's something, that can be kind of dreary sometimes to talk about or kind of a downer, we both have a lot of enthusiasm because of some of the wonderful things that are happening in rural America, in particular here in Illinois, and we're excited to talk about those with you today. So as she said, my name is Adrienne DeSutter. I am a former school counselor and have kind of transitioned to working from home independently to raise my kids. I've got a 5-year-old, 4-year-old, 1-year-old, and then another one coming in February, and that's it. We're calling the troops complete after that. So glad to be here, and I'm going to let Karen hop over and talk a little bit about the Farm Family Resource Initiative to kick us off.
Okay, thank you, Adrienne, and thanks, Jody, for that introduction. It's really nice to be here with Adrienne. She and I haven't known each other for long, but what a wonderful, wonderful resource she is for talking about mental health. And for your topic today, mental health crisis in rural Illinois. So I am the speaker that has to leave at 12:30 because I have another commitment. I'm going to begin by hopefully sharing some slides. We pull those up. Okay. And Jody and I tested it earlier, but I want to make sure you can see them advance. So are you seeing them advance?
Yes.
Okay, thank you. So your promotional flyer said or read, talking about mental health crisis in rural Illinois. What is it? Why does it matter? And what can we do about it? So we are going to kind of mix it up today and begin with the end. So I'm going to be talking about what can we do about it. Now in Adrienne's segment, she'll be talking about some different solutions too. But I'm going to be talking about one solution that we're working on, and that's the Farm Family Resource Initiative. So I am an ag resource specialist with the SIU School of Medicine. with the Center for Rural Health and Social Service Development at SIU Carbondale. And if we've got any Salukis out there, if you're familiar at all with the SIU Carbondale campus, the Center for Rural Health is located in Wheeler Hall. So that's the location that I work from. So in December of 2019, the Farm Family Resource Initiative was launched. And it was really the initiative began by some insight by Senator Scott Bennett. Now, Senator Bennett is the senator in the 52nd Senate District. And Senator Bennett has deep roots in agriculture and a strong commitment for Illinois farm families. And he saw a need to provide some farm stress, farm resources for Illinois farm families. And a lot of other states have initiatives like similar to this and have been for quite some time. Some states are just getting into it. Some have been around to providing resources for a number of years. And so Senator Scott Bennett successfully secured funding for this initiative in the last 3 legislative sessions. So we began with 6 pilot counties in the state of Illinois. Right there in the center: Morgan, Sangamon, Macoupin, Christian, Logan, and Macon. So for about a year, we did lots of things in those 6 pilot counties, testing what would work, what farmers were interested in accessing, what they were willing to access, and what they were willing to accept as far as help in this area. So July 1 of this year, we got an increase in state appropriation to expand to the southern 66 counties in the state of Illinois. And these southern 66 counties are the ones that are served by the SIU School of Medicine. And then just this past September, we received some USDA funding that was secured from the Illinois Department of Agriculture and our director, Director Jerry Costello, to expand the program to all 102 counties. So currently, we're able to serve people in all of the counties in the state of Illinois. The USDA funding is also shared with University of Illinois Extension. So if you're familiar with Extension, I'll talk a little bit later about some of the efforts that they have ongoing. So really our overarching goals of the Farm Family Resource Initiative, and you'll hear me call it FFRI, was really to identify farm family needs, including mental health needs, compiling a list of available resources, creating new resources for farm families, and developing a network of partners, both professional and otherwise, to respond to farm family needs. So we have an advisory council that's made up of about 48 ag industry professionals who meet monthly, really to provide guidance and support, encourage expansion across the state, and provide input for the work that we're doing. So some of the advisory council members are what you would think of as typical ag industry people: Farm Bureau, Farm Credit, Illinois Department of Agriculture. Adrienne also serves as one of our advisory council members. So we rely heavily on those council members and those ag industry partners to provide input and guidance. So when we began in the pilot counties, we first did a needs assessment. And we did that summer, April through September of 2020. We didn't get a lot of response, 78, but at least it gave us some insight into what those farm families were thinking. So 64% said farm-related stress and mental health are significant problems. At that time, market prices for crops and livestock was among the highest concerns. And if a producer was stressed, they would go to a physician, other family members, a faith leader, before seeing a therapist. So this was good information for us, especially a base of a place to start in our pilot counties. So we developed a website. Our FFRI website is siumed.edu/farm. So on the website, we have things like recorded webinars, blogs, resources. So we're really trying to build out a resource page that includes state and national resources, so farmers have a place to go. That's really a work in progress. I think yesterday I just sent to our marketing team another link that I ran across. So if you all know of resources, certainly don't hesitate to share those with me, and we'll include them on our resource page. And if you get a chance to look at it, we have a lot of things that other states are doing, and different phone lines, anything that we think would be of value to a farm family. What we consider to kind of be a centerpiece or a highlight of what we've done is about a year ago, we introduced a farm helpline. So the farm helpline is a 24/7 confidential, can remain anonymous call center. We contract with Memorial Behavioral Health in Springfield, and their call center answers the calls for the Suicide Lifeline. But we have a designated farm line now, the FFRI helpline. And you can see the number here, 1-833-FARM-SOS. So if a producer, if a spouse, if an ag industry person calls in to the farm helpline, they're reaching a mental health professional who's either a bachelor, a master's level mental health professional, a counselor, who will provide some brief intervention and then also provide follow-up if that's needed. Now that we've received some additional funding, we're looking at expanding our farm helpline. So some of the plans are to add a text and an email line. We're hoping this is soon. We're just trying to work out some of the logistics at this time. So what we hear feedback from other states that have helplines and hotlines is that those that have added text and email have seen an increase in utilization. You know, it's really hard for somebody to pick up the phone and call and talk to a stranger. So sometimes a person might feel more comfortable to text. Some people might feel more comfortable to email. So that's why we're going to add those two options. Another thing that we're going to add are some follow-up sessions, which will be telehealth sessions. So the way this will work is that if a caller does call in and would like some additional help, then they will be offered up to 5 free counseling sessions with counselors from our SIU School of Medicine staff. So those will be done strictly telehealth. So on a Friday night, if that's when I wanted to schedule my telehealth session, I could access somebody on my mobile device or on my computer and do that counseling session virtually. One of the ways that we advertise and try to market our helpline is that we have developed small wallet cards, which give information on the front about the helpline and some general information on the back, along with some other phone numbers. So this is a business size card. We try to make this available in the Farm Bureau offices, the extension offices. We have supplied them to grain elevators, just anywhere that we can to be handed out, that someone could pick that business card up, slip it in their purse or slip it in their wallet. And so if I find that I need to have somebody, I want to have somebody to talk to, I could just pull that out and call the helpline. And the reason that I mentioned that, Jody, I'm not exactly sure who all we're talking to, but if you are someone that works in a setting where you think you'd like to have wallet cards available, we have just a plastic wallet card stand with an insert that says, please take one, and these wallet cards. And that's certainly something I could provide to you. Even, you know, we'd like to put those anywhere, in the beauty salon, in the doctor's office, anywhere that people could, they'd be available for people to pick up. So at the end, when I show my contact information, if it's something you'd be interested in, we can simply ship that to you, and you would have some wallet cards to distribute. We also developed a resource guide. with national, state, and county resources. This is mainly to be used by our helpline staff, and it's really a working document, trying to fill that in as we expand beyond our pilot counties. We've offered some ag industry professional development. We trained a lot of ADM staff on how to recognize if a farm family or a farmer is struggling and how to encourage them to get help. In fact, this Friday, we're offering the webinar to the general public. So if any of you are interested, or if you know an ag industry that you think would be interested in that professional development, also reach out to me. Those are all provided free of charge. Our Nurse Scholar program is in a partnership with Farm Credit Illinois and AgriSafe, and that's an opportunity for nurses, nurse practitioners, anybody above the LPN level to receive 20 hours of continuing nursing education. It's all done online. It's all done on demand. So I could take the class at midnight if I wanted to. So the way this works is that a nurse in a rural setting that's practicing in a rural area, again, nurse practitioner could be, they apply for the Nurse Scholar program. If they're accepted and they continue and they complete the program, then we offer scholarships to reimburse them completely for their cost of the training. The cost of the training is $500, so it ends up not costing the participant, the nurse, anything. We provide those scholarships upon completion. I mentioned U of I Extension earlier. They're one of our ag industry partners through the North Central Farm and Ranch Stress Assistance Center, which they are in a group of, you can see on this slide, various states called the North Central states. And they also cooperate with us. They're also serving on our advisory council, and they are also producing a lot of information. You can see that they're providing some trainings and also a clearinghouse website. This is just a slide that shows some of our FFRI team members here with the SIU School of Medicine. And this is my contact information. So I want to pause for just a minute and see if any of you have questions or comments or suggestions, anything that I could provide to you at this time. Okay. Oh, go ahead.
I was gonna say, feel free to use the chat box if anyone wants to add a question there.
So I would encourage you to visit our website and to contact me if you do have questions that come to mind, or if you also would like any of the resources. So things that we have to promote are things like the wallet card stands, like I mentioned earlier. We also have posters, table tents. Maybe you're someone in a community where you know there's a local coffee shop where farmers go. We've got some FFA clubs that are going to be putting table tents in their local restaurants. So we have a lot of things. We'll have things next summer at the county fairs, bags and fans and those kinds of typical promotional items to help get the word out. But if something comes to mind that you think you could use in your community to help people know about the Farm Family Resource Initiative, if you shoot me an email or if you want to call me, it's something that we could ship to you at no cost if it's something that you think you could use in your community.
And Karen, we have one question. Do you have the cards available at financial institutions that the farmers frequent by chance? Do you know?
So we've not sent any to any banks. Places like Farm Credit or your typical ag lenders do have some. Your bank in your local area, they most likely have not received any unless somebody has just provided it to them locally. But that's a good idea, and that's certainly an area that we want to reach. We've just not done that yet. Now, if there's somebody out there though that says, I would take that to my local bank, we could certainly provide you with those.
I have a question. This is Deborah Humphrey from Madison County. In regards to the telehealth, you mentioned that you do pay up to 5 therapy sessions through that. What happens if someone needs additional treatment at that point? Do they make referrals then to other resources, or how do you manage that?
That's a good question. So first, let me share that our telehealth is not in place yet. We're just now finalizing it. So it can be up to 5 counseling sessions for individuals, for couples, or for the farm family together. So beyond the 5 sessions, if there are more that are needed, those can be arranged through the SIU School of Medicine, or there'll also be local referrals. So if a person wants to continue with their counselor at the SIU School of Medicine, they will be able to do that. It's just that after that time, there will be a fee, either that your insurance would provide or a fee that you would be responsible for.
Thank you.
Yes, thank you. Any other questions? Okay, again, I want to thank you for giving me some time on your agenda. And as I turn it over to Adrienne, you'll learn so much now. I hate that I have to exit because I love hearing Adrienne present. So thank you so much.
Thanks so much, Karen. Appreciate it.
Appreciate it. Bye-bye.
Bye-bye.
Thanks, Karen.
Thank
Jody,
you.
unless you have anything to shout in the middle here, I'll go ahead and start sharing my slides here. All righty.
Sounds good.
All right. So as you heard, Karen and I both do the majority of our work directly with agriculture and within that industry. But I'm sure all of you are well aware that the rural areas in Illinois and across the country are not entirely agriculture. I grew up in a town of 2,100, and I'm in a town even smaller now. And I did not grow up in agriculture, even though I was surrounded by cornfields, bean fields, whatever. And I was very removed from agriculture. So, you know, that Farm Family Resource Initiative is something that is specifically for farm families. Not that there aren't the webinars that they're doing, the presentations that they're doing can definitely expand well beyond just agriculture. So if there are, you know, they have some really nice, they have some great grant money. They have some great resources and connections. Their network is wonderful. And so if you feel like there is a webinar or a presentation or just exactly like what we're doing now, where you have an idea on something that you want covered, FFRI is a wonderful place to start when it comes to looking for that type of resource beyond just agriculture. So rural life, speed limit 5, right? We're in this beautiful area in rural America. It's quiet, it's peaceful, it's calm for the most part, right? It's a little bit slower than city life. That's why we're out here, right? Or you married a farmer and that's why you're stuck out here. But no, I'm just kidding. I love living in rural Illinois. Wouldn't have it any other way, but I definitely didn't have plans to stick around here. And the farmer kind of didn't leave me any choice that way. So anyway, it's a wonderful place, but we know that with a lack of people, there is an economy that is not quite the same as city life. We don't have the same resources. We just don't. We lack in our healthcare, obviously. We lack in a lot of things. We lack in, you know, our schools aren't getting the same type of funding. Our organizations aren't as big or aren't as booming sometimes. The only thing I think in our area we have are Christian churches and bars on every corner. So like rural America does have that going for them, but there's definitely a lot that we don't have. And so that's what we're going to focus on today, are just a few of those things that we don't have, but a lot of what we do have too. The rural mental health care crisis is that lack, that shortage. So over 60% of areas with a mental health professional shortage are rural. So across the state, 60%, they actually designated places that say you don't have enough mental health professionals compared to the people that live there. And that's over 60% of those areas are rural. Now, this is sort of interesting, and this is a little controversial out there. The rate of mental health conditions, so depression, anxiety, schizophrenia, whatever illnesses, disorders, whatever you want to call them, there's some contradicting information out there, but what I have found is those rates are not necessarily different when it comes to rural versus urban populations. In children, we do see children in rural areas with more mental health conditions, but overall, the rural and urban comparison is pretty similar. I know my brother-in-law works in Washington, D.C., and he has his own practice. He's a pediatrician there. And he said over the last few years, even before the pandemic, over half of the people, the kiddos that were coming in, were there for mental health related issues that he was having to then, transfer to other places. So there's definitely a lot of mental health conditions out there. But the difference in our rural area is that we don't have the same type of care as people in urban areas do. And we're going to talk a little bit more on that. In fact, 95%, that's a big percentage there, right? Of mental health providers in rural areas, they self-report that they're unable to meet the needs of their patients. That's a huge, huge amount. And I think part of that, again, is because of that specialized care. I read an article recently about a woman who had someone coming in with an eating disorder that, as any good counselor would, you have an idea of how to treat basically anyone. You're trained on how to solve problems across the board. However, we know that someone who specializes in eating disorders or in substance use or in children, for example, they're going to have more expertise, more specialization, perhaps more resources for those specializations. And we don't get those as much in rural areas. And finally, our ratio of psychiatrists to residents in rural America is 1.6 for every 100,000 people. We have 1.6 psychiatrists for every 100,000 people in rural Illinois. That is like tiny, right? And there's even fewer child psychiatrists specifically. So the shortage is real, right? Just to put a visual to it, this is just an image of all the different behavioral health centers in Illinois. This includes mental health and substance use, which we know behavioral health includes both of those things. This is directly from the SAMHSA website. I just did a search for the behavioral health centers in Illinois. And as you can see, we got a lot up in that corner there, and then they're kind of dispersed throughout the rest of the state, right? So behavioral health centers, this isn't going to include every single counselor, every single therapist or anything like that, but this is going to include certain registered counselors, certain hospitals, community-based and inpatient, outpatient-based. It just all kind of, there's several there. And we see there that if you take a peek, we've got what they listed was 1,033 total centers, and about 650 of them are all up within that radius, that 100-mile radius of Chicago. So I'm saying downstate, everywhere outside of that circle, we have about 380 different centers. I noticed that Maggie Brooks just made a comment. We're struggling to find qualified candidates to fill open positions in our areas due to expectations for services and low salaries. We're going to talk a bit about that, but I really encourage you. Thank you so much for sharing that. I encourage you all, if there are, there's relevant statistics that you have, there's data that you have, personal experiences that you all have. I may not read all of them in the chat box as we go on, but please share, because this is something that many of you are working directly with. You're seeing this. So your input is very, very valuable here, and that collaboration is really important. So thank you, Maggie, for sharing that. Other disparities, other than just that shortage, right, a number shortage. In rural areas, we find that these services are underutilized. And as Maggie said, we don't necessarily have people to fill the spots. The people who are in those spots are completely burnt out, which we'll cover in just a short bit. But even knowing that, we still have so many people that are going uncared for. And that leads to hospitals closing. That leads to, I think not that leads to, but part of the problem is in our rural areas, that stigma. In urban areas, you get more and more people that kind of buy into the idea of mental health needing its own treatment. We don't see that buy-in in rural areas. We also have insurance coverage issues. In rural areas, a lot of times you have large populations who are either self-employed, like the agriculture industry, or own their own small business. Any type of self-employment does mean that typically your insurance is going to have to be a little funky. I can tell you as a self-employed, as farmers, as a farm family, our insurance is a nightmare. The coverage is subpar, but the premiums are astronomical and the deductibles are astronomical. So I have to meet like $6,700 individually right now to be able to meet my deductible, $6,700. Now I know there's all sorts of different plans and things like that. Marketplace is helpful that way too, to help you compare when you're self-employed. But the reality is, especially our farm families or our self-employed families aren't going to have the same insurance coverage as someone that maybe in a group plan has. So you have those networks, right? And your insurance networks of providers that are in your network, that's also going to limit who you're able to see if you need some type of help. I can tell you just as a side story to that, when I was working in the schools, we would have students who came in and if a student expressed any type of suicidal ideations or any type of mental health symptom, that was something that we needed to take a peek at, have a different type of professional look at. There is a really wonderful number that you can call for those who are uninsured, to have someone come out from your local behavioral health center, do kind of a scan, make some recommendations, provide some resources, but those who were insured were not able to use that. So anyone who had insurance, any of the students who had insurance, had to go through, again, those people who were in network for them. And it's just a whole different conversation when you're talking about suicide, conversations with teenagers, how their parents are going to react, how we can get them into, they either had to go to the emergency room or they had to drive directly to someone within their network. So there was just a lot of challenges when it came to insurance. And that's not just in our rural area, that would be anyone, who's uninsured or who has higher deductibles and things like that. Telemedicine, we know within the last year or so that the telemedicine has really been a lifesaver, quite literally. And it's a wonderful thing. I can tell you that I myself, within the past year, have reached out to a therapist using the telemedicine option. And I'll speak on that a little bit later. But one of the conflicts we find with telemedicine, so even though that we don't have as many providers out here, and we have this access to telehealth so that we can speak with people that are outside of our rural areas, we also struggle with that because, number one, a lot of the reasons why they are allowed to reach us is because it's under kind of an emergency order. So some of the stipulations are not there right now. I think we're eager to see what happens once the pandemic slows and comes to an end, or whatever is going to happen this way, what they're going to do with those rules. Because, for example, right now I have a counselor who is out of Iowa. Luckily, she has licensure in both Iowa and Illinois. But some don't. And so right now there's a little bit of flexibility with crossing state lines. Some states have conditional licenses so that if you're from a different state, you can provide services. There's just some some different options there. But with licensure, it's tricky because some of those rules are going to be set back up soon. So that telehealth is not necessarily going to be as accessible. In addition to that, providers aren't necessarily reimbursed the same. Your counselor doesn't receive the same from your insurance by providing telehealth as they would in person. So that's something that I think sometimes causes a barrier for people to want to provide that. And finally, a lack of broadband. Again, when we're talking about telemedicine or any type of virtual resource, we know in the rural areas that broadband is not something that we have quite as readily available or as quick, high speed as those in our urban counterparts. This is a statistic from the end of 2018, so not quite as applicable now, but Southern Illinois actually did a study and found that 37% of Illinois residents in rural America did not have high-speed internet. So again, I think that that's probably changed. I think that number is probably a little bit better because there have been a lot of initiatives. Farm Bureau has been on it. Even just the telephone companies have done a lot of, made a lot of changes with trying to get broadband available specifically to students, but to everyone really. So hopefully that lack of broadband barrier is coming down, but that's still something that we have as a conflict here in rural America, and in particular in Illinois. So what does this mean? What does this shortage mean? What are all of these things? How does this impact us? How is it relevant to the way we live and where our rural families live? Well, first of all, obviously we have reduced access to providers. We know that our travel times to clinics, to counselors are a lot greater, which means our transportation is greater, which means it costs a little bit more, which means not everyone has that transportation readily available. So just the access physically is not quite the same. And again, I dealt with this quite a bit actually with students at the school that I worked with when they needed to have some type of services. It was a challenge. If you had an inpatient student, for example, or a teenager who was spending the night at a behavioral health center, that sometimes was a 2-hour drive, a 4-hour drive. If you had someone who needed services that far away, you'd have to make that drive twice a day to go pick that kid up if they were outpatient. So definitely transportation is an issue. In addition to that, our emergency services take a lot longer as well. We have fewer emergency services. We are grateful in our area to have different county ambulance and firefighters and things like that. But, and those people sometimes have some good training on mental health related crises, sometimes not. But those emergency services do take a longer amount of time to travel. And so actually rural Illinois, and again, rural America, we see more unnecessary deaths just because of the travel time of our emergency services. And that again, is not to their fault, it's just our lack of resources out here. So that's an unfortunate truth. A lack of professional connection. So again, because we have this shortage, because we have these issues, we sometimes have a lack of professional connection between the clients, those who are utilizing mental health resources, and the centers themselves or the professionals themselves. We talk about this, I think I mentioned this in the agriculture presentation last time, but the idea that we have to kind of shop for a counselor like we shop for shoes, right? You can't just try the first one on you see and it's going to work great. Sometimes you got to pick ones that are a little more comfortable, pick ones that fit you a little bit better. And that is really important because a lot of people, when they see a counselor, if they don't have that connection, they quit. They say, this counseling stuff isn't for me. We're done here. And that's harmful. You know, obviously then that person isn't able to receive treatment the same way. But because of our, in-network, our insurance networks, because of the way that we only have a few options around us, we sometimes have that trouble where people don't feel as understood in their counseling session as they need to. Actually, I know a woman who she was a widow, and she called the National Suicide Prevention Lifeline, which again, I'm not bashing that lifeline. It's a wonderful, wonderful resource. But as a rural farmer, she called that hotline, and she told me that when she hung up, she actually felt in more of a crisis than when she called. And it was all because she felt so misunderstood about the way that she lived her life and the way that her, her firm family was working. And so again, it's just that there's just this misunderstanding when it comes to the way rural people live. There's a cultural divide a little bit. And so that's one of the problems that we're seeing. Now, as I mentioned earlier, even though the rates of depression, anxiety, etc., those mental health conditions aren't necessarily more in rural areas, we do know that the rate of suicide and the rate of opioid use or abuse is anywhere from 2 to 4 times higher in rural areas. Overall, it is 2 times higher, but in specific populations, it's up to 4 times as high in our rural areas. Part of that is our access to lethal means as well. Again, being whether it's a farm family who has, grain bins or tractors or equipment, I should say, or just the idea that guns are very popular in rural areas. We just have an increased access to lethal means, which is one of the risk factors for suicide, unfortunately. And then there's burnout. And I know many of you who serve on these boards, whether you're in mental health or not, or just regular healthcare, or whatever it is that you do, we know in rural America there's burnout, right? When I was working in the school, I would attend a counselor association a few times a year, which is a big meeting with counselors from Quad City area and then surrounding counties. And people occasionally would say, oh, it must be so nice to work in a rural area because you have like half the students that I have, and your caseload is so much smaller. And I always wanted to chuckle because I may have seen fewer students, but number one, I was the only counselor in our entire middle school and high school, so 6th grade through 12th grade. I was covering all of those grades. So my number was different, but my expertise had to be, I had to know how to do counseling with all of those different grades at all those different developmental levels. I had to create the post-secondary plans, the life after high school plans for all of the students. And so again, there's no specialization. You're doing a lot of work in a lot of different areas. I had one teacher who, even though we had 6 periods in the day, she knew it was so important to provide content that her kids needed that she would create classes. So she was teaching multiple classes at once. So she had like 8 different classes that she taught. I'm comparing that with a friend of mine who lives in Colorado in an urban area who has, 6 different class periods, but she only teaches 2 classes and just multiple sessions in each class. So she only has to prepare really for those 2 classes compared to this woman preparing for 8 classes. And that's just a sample of why we get so burnt out in these areas. We're overworked. We don't have people to fill these shoes. We're doing a lot. And that's hard. And I think the rest of the country right now is starting to see some of that. Healthcare is certainly starting to see some of it, not that they weren't before. But the rest of the world is saying like, we need more people, we need more employers or employees. And more work is falling on the shoulders of people who are working, which again, that overwork feeling is providing that burnout feeling. We're doing it all, really. And because of that, our wait times for counselors and non-emergency services is for like if you had someone who was suicidal at the time and you went to the emergency room, they're going to find something that works. Don't get me wrong, but I was working with a group of farmers one time, and she said, a woman there said, I finally got my husband to agree to see a counselor, which was a long time coming. But his wait time, once they called, he couldn't get in for a full month in that rural area. And she's like, by then he's not going to want to do it, but that's what happens when we just don't have the numbers and we don't have the staff. And again, we kind of talked briefly on stigma. But again, in rural America, we have this culture of being hardworking. Mental illness and mental health is still viewed as something that is not the same as physical health, and something that is taboo, and something that is a sign of weakness. And so that is one thing that we struggle with out here. And in addition to that, you're not all wrong. I don't blame people entirely for feeling that way. And there's a couple reasons why. Number one, there's certainly a lack of privacy. In rural Illinois, everybody knows everybody. If you've got a counselor in your area, they're probably going to church with some of your friends, And so even though a counselor's bound to not share things, they may know things about you that I can understand why that would make someone feel uncomfortable. You're going to drive your truck up or your car up or whatever to that therapy office, and everybody in town is going to see it's there. So I understand why there's that hesitation. In fact, my husband works in agriculture, which is ranked like the most hazardous job in the world. Being a farmer is actually ranked very, very high as far as hazard and safety goes. So they strongly encourage farmers to have disability insurance and life insurance policies. My husband isn't able to get a disability insurance policy because he is on medication for a mental health condition. So he's completely unable. They will not give it to him. He even had an insurance provider one time tell him, if you just go off your medicine for about a year, then you can, it doesn't matter. You can go ahead and mark that you are all good. So he actually had someone recommending to him that he stop taking his mental health medication so that he's able to report truthfully that he can get this disability insurance. So that is a struggle that we have dealt with here. So I definitely understand. And our life insurance rates are astronomical, again, because he reports that he has that condition or is on those medications. So stigma is real. We can do a lot to combat that, definitely. But I don't entirely blame people, because there are some things, the way our system works, that are not supportive of people being treated for their mental health conditions, unfortunately. So I'm going to spend the rest of the time today talking about our proposals, our solutions, what can we do about this, right? Karen gave a nice introduction there on the Farm Family Resource Initiative, so I'm not going to talk too much about that, but there are a lot of things that we can do and that we can focus on. I think a lot of times we get stuck in this idea that, we don't have the resources, we don't have enough, and that really bogs us down and pulls us down. And it's important to talk about those things to recognize how we can do better. But I also think it's important that we focus on the things that we do have and the things that we can do. So my first topic today is combating that rural stigma. One thing that you can do in your place of business, in your communities, wherever you are, in your churches, whatever it is encourage leadership from your community members, in your community organizations. Encourage people to speak out a little bit on mental health. Encourage people to reach out to Karen and get those cards. The Illinois Farm Bureau also has wonderful, wonderful resources. They have just the most fantastic brochure with warning signs and wonderful talking points. So there's that type of stuff. The more that we get that out, and when we see our community leaders showing that it's important to talk about mental health, showing that they care about our families and our health and our wellness, I think that leadership really goes a long way. I saw that when Bayer originally, if you've heard of Bayer, they launched the initiative called Farm State of Mind, which is now owned by American Farm Bureau. And when they did that was in 2019 that they launched that initiative. It was the first time on a big scale that agriculture was okay to talk about stress and mental health. And at first people kind of went, whoa, here we have these real hard farmers and they're getting this conversation. And it wasn't well received by everyone, but as a whole, it was definitely well received. And you started to see then all sorts of other ag organizations that were jumping on board. And we have wonderful things happening right now in agriculture in mental health because of that leadership. Excuse me. Another thing we can do to combat stigma, try to negate that stigma is sharing personal stories, however you can fit it in, especially with people that are respected in your communities. It can be as simple as a Facebook post, on National Suicide Prevention Week. It can be, I had a farm couple who lost their father to suicide, who decided they wanted to have a small gathering at their church of people. They brought in 40 people, I think, from their church, and just talked about their experience losing their dad, and then shared some resources. And it was that personal touch, the personal, real things that are happening in the world of mental health is so important for people to hear, because it pulls others out of isolation. Those who are struggling, maybe not realizing what they're going through is a mental health condition or an issue of some sort. That leadership, those stories are what allows them to say it's really okay to be in the shoes that I'm in right now, and that there really is something that I can do better. So I think that's really, really important. And actually, again, just to go back to my husband and his experience, and I share him because I think he is a very standard male, hard male that's not going to pay attention to mental health related stuff. If he wasn't married to me, he probably wouldn't be at all, wouldn't be caring about this stuff. But he's someone that when he overheard another farmer mention, this guy said, I go to therapy. I haven't really told people that, but I'm on medication and I go to therapy, and it's saved my life. It saved my marriage. 100%. It's made me a way better person. When my husband heard that, the weight lifted off of his shoulders, he said, for the things that he's had to go through so silently, for his medication and his therapy and his, mental health experiences. It just made him feel like so much more of a human to hear that somebody else who is a well-respected person was going through some of those same things. So anywhere you can encourage personal stories is great. Promote self-pay. This is one thing I think it sounds silly, but has made a huge difference in our home. You don't need to have a diagnosis to go see a therapist, but not everybody knows that. You don't need to go through your insurance, and not everybody has to, not everybody knows that either. You can go and you can say, is there a discount if I self-pay? And there typically is. And so that's a huge thing. When I self-pay, and my husband as well, when we have gone through therapy for different reasons, that self-pay option has taken a ton of money off of the price tag, because our deductible, again, is so high that if we went through our insurance, we'd be paying twice as much every time. So self-pay is something that I think is really important, and it's really easy. It's just something not everybody knows about. But if we can do more to this is not something that's removing stigma by any means, but it's saying, even though stigma is there, if you can say, you don't have to have a diagnosis, you don't have to go in there and say that you're depressed or get some type of, test done. You can just talk to a therapist and pay out of pocket for it for a cheaper price. Then that's something that I think might be attractive to some people. And finally, community wellness hubs. You may, I don't remember if we talked about this or not last time, but as I mentioned earlier, that idea of your truck sitting out in front of the therapist's office, and that's, people don't want to do that. Well, if your truck's sitting out in front of your doctor's office, that's a slightly less uncomfortable feeling. There's still going to be, again, in a rural town, there's always going to be talk about what's going on with who. But there's this idea that people have come up with in different areas called community wellness hubs, where they have a center that is, their doctor's office. Maybe it's also a dentist's office. Maybe it's also a chiropractor's office, whatever. My brother-in-law that I talked about in the city, he kept having people coming in for mental health issues. So they actually hired a therapist. So in their office, they now have a therapist. So that's just one way to kind of, again, respect that privacy and combat that nervousness about privacy that we have in rural areas, that we can encourage that as well. I've started to see that a little bit, but actually what I've seen specifically is that you have a behavioral health center who will send a therapist to a doctor's office and see people there. So you don't necessarily have to, combine forces and collaborate that too much physically, but just allowing that option for therapy to be done in an area that is less controversial, I guess, than the therapist's office can be beneficial. Okay, so we talked about how do we get people in there a little bit? How do we beat the stigma a little bit? How do we address that idea of underutilized services, right? So now we've got people, maybe we've learned about some things where we get more people in, but where are we going to send them? Because again, our resources aren't there. We have a shortage. Let's focus on what we do have. Focus on what is existing currently. So let's increase our awareness of our existing resources. First of all, I can tell you that even as someone who is a former counselor, we have mental health issues in my home. I am passionate about mental health. Even I have no idea what's going on across the entire state of Illinois. I don't know every single thing. I have an idea, but I don't know everything. And even when I'm going to find something, sometimes it's hard to find. So can we do better about our marketing of what we do have? One idea, and this is talking to my husband again, is the whole idea that, if Bridgeway is our local behavioral health center, okay, we have them in Kewanee and Galesburg, we have a Bridgeway. And if he saw a Bridgeway commercial that talked about mental health, this is not to call out Bridgeway because they're wonderful, but he's probably not going to care too much about what they say on those commercials because he's going to think, that's not me, I'm not that bad. I don't have depression that bad, or, what we do, Bridgeway offers so many wonderful resources, but people get caught on the idea, again, that stigma that that's a mental health or a behavioral health or a treatment center. And that's not for me. So what can we do to break that down a little bit? How can we connect with people in a little bit different way so that things seem not as frightening, not as disconnected from where you are? And secondly, can we encourage more collaboration? I am all about collaborating resources when it comes to our small towns. So if you have a Bridgeway, for example, again, your behavioral health center, can you work with your local farm bureau, for example, and provide some resources? Bridgeway did a wonderful job with us once we had a mental health event, and they brought some of the resources over so that our farm bureau members who maybe never would have been exposed to Bridgeway's services at least had a brochure that they could peek at or listen to a speaker. Bridgeway also does a wonderful job where they host this annual wellness event for the community. And it's wonderful because, again, it's not focused on mental health per se. There's all sorts of different workshops that you can attend. So it gets a lot of teachers in, they get a lot of, all sorts of business owners and things like that, and learning about wellness. And it's less frightening because, again, it's not I'm going to therapy, I'm just going to learn. So they collaborate with all these local resources so that they can expose people that wouldn't normally be exposed to their material. Oops, just a second. There we go. Existing resources as far as telehealth goes. This is something, number one, that can also help us with that burnout that we talked about, or those ratios that are horrible when it comes to our lack of mental health professionals in our area. Can we focus more on telehealth? What can we do to expand our telehealth options? Number one, again, can we market it better? Can we tell people in our area what else exists? I don't think everybody knows about telehealth. They may have heard commercials for BetterHelp or something, right? Which is, its own resource, but can we help connect people with their insurance companies or with particular therapy offices that do offer telehealth? Can we explain that in a better way? I think the more we can expand on that, the better. I think also what we need to do when it comes to telehealth is, again, promote the idea that these cross-state licensure issues, that's a problem. And right now is a perfect time to do that, to speak with legislators or with your mental health centers on what can we do to your media again, media is a double-edged sword because whatever you put out there, everyone sees, right? But whatever you put out there, everyone sees. So if you can get the idea out that telehealth is a great thing, and that there are some conflicts, the more people we can get on board with this whole idea that we can we do more to break down those state the state boundaries, or there's some states that have done like conditional licensing and things like that for providers out of state or out of region. So can we do more of that? So this is just a couple of things we can do on what we already have. But then there's a lot more resources out there specifically that we can amp up and that we can talk about and that we can focus on. I want to say, before I speak just briefly on these things and check my time and make sure we're not too far out yet, I want to just mention that, when I say here, can we encourage more prevention, more coping skills? Can we get more of that out there so that we can free up some of our therapist space? If we can get people to the point where instead of waiting till they're at their rock bottoms or waiting till they're really struggling before they go to a therapist, can we provide more prevention opportunities, more self-care information, whatever? My caveat is that a person with severe depression, that's not who I'm talking about here. Certain people in certain situations need professional help, 100%. So I'm not trying to minimize that in any way. But for those people who, again, who the farmer who said he would finally go and now he's got a month to wait, what can we do with that buffer time with those people? And I think that coping skills is important. And again, prevention is important. If he wasn't waiting for his rock bottom or waiting an entire year like my husband did before he decided I'm going to seek therapy, and then he waited an entire year before he actually made that call. And a lot happened in that year. There's a lot of lows that happened in that year. So if we can do more prevention and get people calling earlier and doing things earlier, that's going to free up some space in our rural areas in those offices. But some things we do have, we have an employee assistance program, right? Those are resources that essentially provide support during difficult times. It's not a counselor necessarily. They provide free information, free conversations, consultations. They do sometimes offer referral and counseling services, but a lot of them, any state employee can access those programs through their employer. But then there's also a lot of people who have those as part within their either a place of business or organizations like Farm Bureau. I don't know that Farm Bureau has it, but I worked with one organization called Family Farms, and it was just like a group, essentially, a community group, and their community group offered that employee assistance program. What do our hospitals already provide? So I know there's all sorts of different hospitals throughout the state. I just know locally, OSF is who we have around here, and they have a wonderful behavioral health navigation program. And this is one of those times, I'm going to go ahead and say, if you have other things that you want to throw out there, some resources that you have in your area that you want other people to know about, throw those in the chat box, because that's a wonderful way to share. I think I've said the word wonderful 1,000 times today. I'm going to try to stop doing that, but it's a long time to talk, so my apologies. Behavioral health navigation is a wonderful, see, there we go again. It really is a great tool because it allows anyone within a region, an OSF region, to call these navigators, talk through some issues. The navigators can kind of rank them and help them understand if what they need is conversation, or if what they need is a counselor, or if what they need is an emergency room. And then they can also work with them and their insurance providers to figure out where they can go within that. So it's this perfect basic tool for people who don't know how to navigate the behavioral health system, because they kind of navigate it for you essentially. And they also have a Silver Cloud app, which again is just an app that people can use that has different cognitive behavioral type activities, I want to say. Again, there's an assessment so they can help you decide, see if you need to go, seek other help. But it has some really nice tools and tips that you can use as well at your own leisure. So anyway, that's something that we have already. The Illinois Mental Health Collaborative essentially it's a partnership with IDHS, and they provide all sorts of resources. And again, it's kind of a central hub, from my understanding, on what we have as far as mental health in Illinois. We probably all have heard about the new Call for Calm text line that you can text talk to 55-2020. That is something that Pritzker announced or created during the pandemic to address stress, mental health concerns, and that allows people to be connected with counselors if they need them, or again, just have that conversation to help lighten the load a bit. The Illinois Warm Line is another thing that we have, which again is not staffed by professional counselors, but it's staffed by support specialists. I don't know exactly what their title is, certified recovery support specialist, something like that, but it's people who have lived experience through all sorts of different mental health conditions, or substance use conditions within their family, things like that. But they are able to provide some really solid support when a person isn't able to necessarily get to a professional right away. And there's also mental health advocacy groups throughout the state as well. One example, in Henry County, where I grew up, they have the Henry County Mental Health Alliance. So again, this isn't counselors, this isn't professional help, but this is people who can help provide resources, help provide empathy and listening, because that's what we know is number one when it comes to mental health. The first thing that people need more than anything else is to be understood, to be heard, to have that empathy and those listening ears. Obviously, it doesn't always stop there for many people, so I don't want to minimize that, but it's great to have groups like that. Another one in Montgomery County is Crossover Ministries. They are a religious-based organization that, again, tries to combat mental health issues in their area, so they can provide resources and things like that as well. Thank you, Maggie. Yes, Warmline is only daytime. It is not a 24/7. I believe it's Monday through Friday, like 8 to 5 or something like that. So, and Jody, thank you for mentioning that. Do you guys say ACMHAI? I'm not sure how you say it, but
ACMHAI.
Thank you.
Yeah.
They also have resources on there as well. Farm Bureau also has resources. That, as Karen mentioned, the FFRI page also has resources. So I just think it's really important, again, when we're talking about what we don't have, to focus on what we do have, because there's stuff that we can be doing and that we have done, and that we put a lot of time and resources there and there. So thank you, David. I see another one mentioned. Anyone else who wants to throw something up there, go ahead. I'm going to keep going because I just got one small section left, and then we'll be up for questions if you guys have them. So how do we now that we have, hopefully gotten more people coming to seek out these resources, what do we do about this burnout, right? What do we do about this shortage of providers and these resources? Where are we going to send these people if people are feeling overloaded? And one of the ideas that I have had, as well as you'll see a couple different resources at the bottom from other professional resources, is to recruit rural, right? To get people back into rural Illinois. One of the ideas is that we expand rural curriculum and opportunities in grad school. So for counselors, for medical providers, social work, any type of place where you're going to have people working with the health of other individuals. Make a point to address rural specific concerns, right? So we talk about cultural competency in grad schools, right? And in our doctorate level things, and even in undergrads at this point. Cultural competency is important. It's understanding how culture impacts the way we are. And rural is its own culture. That doesn't mean everyone in rural America is the same by any means, but it has a culture that you've grown up and been raised in. So if we want to address some of that disconnect and that lack of understanding, let's do more in our in our programs and our school programs to help people understand what the differences are between rural and urban cultures. And then also provide opportunities for people. I can tell you that I was passionate about rural America. And so when I was in my undergrad at Illinois Wesleyan, that's in Bloomington, so obviously not a rural area, but I specifically requested a rural school. So while that wasn't typical for them, they did find me a rural placement to do my counseling observations and things in my practicum in. But I could tell it was something that was they wanted to help me with, but wasn't something they normally did. And so that's important. If we can provide more, there's actually research that shows if we can provide more training and we can provide more exposure to students with the support of their staff and their faculty and in those grad schools, we can get more people opting to go back to rural areas. And U of I does have right now a program that is not specific to grad schools. It can be used at some grad schools, but it's for continuing ed for behavioral health workers, social workers, counselors, etc. Where it is specific to agriculture. So it's kind of like the training I did last time where, what are our signs and symptoms? What's unique about agriculture and that industry and those stressors, but they have a program that can provide continuing ed credits. So that's exciting for people, but that's a perfect way to get people to understand a little bit more about rural needs. Create partnerships to recruit and retain. So again, who can you collaborate with in your area? What can we do more of? One program, again, research shows that people who grew up in a rural area are more likely to come back to that rural area than someone from a city or someone from another area coming back. That's good and bad, in my opinion. It's good to keep things diverse. But Illinois Farm Bureau collaborated with the Rural Illinois Medical Student Assistance Program, and they offer a scholarship for nurse practitioners. It's a $4,000 scholarship for a 2-year requirement that once that person graduates, they work in a rural area for 2 years. And I think it's pretty loosely defined. It's like less than 60,000 people or something like that. So, depends on how you define rural, but that's a really great way, a good example of how they collaborated to get people to come back to their roots, right? Or to get back in rural Illinois. And of course, that doesn't have to be a rural student. You didn't have to grow up in a rural area to utilize that scholarship or apply for that scholarship. But it's just a good example of how to get people back in our areas. Address those telemedicine limitations. We've already kind of talked about that, so I'm going to kind of skip over it. But I did want to mention again that there are states that are doing things that are either providing conditional licenses for out-of-state people. Some states, 3 different states, have created what's called a registry for people who are out of state. So they are allowing them to practice as long as they're on a registry that shows that they don't have the same qualifications as another in-state therapist might. But those are just some ideas for how we can get more people, more providers able to work in telehealth. And integrating behavioral health into primary care. Again, this is one of those things that has, that's good and bad. The idea is that we do more with our general practitioners, our primary care providers, those nurses and those staff to help them understand more about behavioral health, give them more power as far as medications and things like that and assessments, so that people are more likely to learn more about their own behavioral health just by going to their typical checkup. Again, rural doctors are just as burnout as rural mental health professionals. So I'm not suggesting we put a lot more on their plate, but this is just one idea of how we can collaborate and try to get more people exposed to treatment options. And finally, I'm going to wrap it up by talking about supporting the legislator. This is legislature. This is our really top-down type of thing. Number one, we have to communicate with our legislators. And I know that is a scary thing when you have never done it. I was in DC for a communications training a few years back. And part of our job in this training was to work with our state legislators. So I met with Tammy Duckworth's office and Sherry Booth's office, and expressed my own concerns about mental health and about the suggestions that I have. And it was really exciting to have those conversations because now I know politicians can act like they care and not really care sometimes. I've seen the campaign, right? Anybody else seen that? I feel like we're living that some days, but but the idea is that sometimes, you know, we don't necessarily trust all of our politicians, and that's fine. We have reasons for that. But there's a lot of good that can happen when we, just standard people, take time to communicate with our legislators. And I wanted to share that with you, because once they see the value in what you believe in and what not just you as an individual, but your organizations, what you've done, if you can share how that more people care about things, then those politicians can do more to promote or fund your initiatives. That's how we have FFRI. Is simply because we have a senator who saw the value in mental health and agriculture and started to do something about it. But I can tell you that Tammy Duckworth did a phenomenal job. Her staff, I should say, did a great job listening and wanting to hear about our broadband experiences. That is something that her team was working closely on, was promoting broadband in rural areas. So she wanted to hear personal stories, and she used some of those stories. I'm not gonna bump ahead just yet. Dan Swanson, he is the representative in my area, state representative, and he is someone who has done a whole lot. He has posted individual videos on mental health for farmers in rural communities. He has he hosted his own mental health meeting, I should say, in his home in my hometown actually, for farmers to talk about mental health. He also hosted a meeting, I think, for other state government politicians to hop in on with Farm Bureau so that they can hear more about the issue. So just by planting that seed in their minds, they're starting to do more things. Bustos, I met with her once in DC, her office once in DC, and then once here in Rock Island. And she has sent staff to multiple presentations that I've been a part of and organizations that I've been a part of. Tony McComey was someone who she attended a mental health training with the Farm Bureau in Rock Island. And at that meeting gave some really good ideas, genuinely good ideas about exposing more people to that information. So the communication, while again, it seems kind of scary, and I'm happy to give some tips if anyone's interested in reaching out. Shoot me an email and I can share some things and some contact information with you. But speaking with legislators is important. And what you do is you go there to promote programs or to promote ideas. They don't just want to hear your thoughts, they want to hear your solutions. And so these are some of those things. So Farm Family Resource Initiative, we already talked about. The Farm and Ranch Stress Assistance Network is actually a federal program, but you know, it is meant to increase mental health resources. So that's another one that we tell them, please support this, please fund this. Hospital 2595 requires every insurer to provide medically necessary mental health care. That's an Illinois bill. The Community Emergency Services and Support Act bill requires that they're working on that new 988 number and trying to help expand the training and the knowledge of mental health and behavioral health to prevent incarceration or excessive force with those behavioral health emergencies. There's a couple other bills on there, and then Rebuild Illinois is the infrastructure bill that included $400 million for statewide broadband. Some of these things have already passed. Some of these things are still in the works, but I just thought I'd post a few out there because, again, when you're talking about top down and we're talking about needing money and wanting to see change, this is how we do it. We go to our legislators and say, this is what needs to change and this is how we're going to do it. And these are the things that you continue to support. So there you have it. That's the rural mental health care crisis in a nutshell, kind of some ideas of what we can do. And I have to just say, again, we talk about what we don't have, but what we do have in rural Illinois is a rural family. Our community is our family and we care a lot about each other. And so I think we have that going for us. And I think that there's, with a lot of people's passions and concern for each other, there's a lot more that we can continue to do. So I encourage you to reach out if you have questions. My information's on there. Karen's information is on there. peek at the Farm Family Resource Initiative webpage if you are interested at all. And with that, I'm going to ask for any questions. I see there's a couple more really good resources on the chat box from people. So definitely any of those places, if you're concerned. Hannah, yes, I can share the slides with Jody if you'd like. And if you're concerned, if you have any interest in learning more specifically about agriculture and stressors that way, let me know. But if there are topics that we can help provide, your group with, then contact Karen at Farm Family Resource Initiatives. I don't work with SIU. I'm just on the FFRI board, and so she a lot of times contracts me to help speak as well. So you can go directly to me, or you can go through Karen if you are looking for any type of topic related to mental health that we can help educate people on.
Great. Oh, we have a question here. Do you feel that mobile health clinics would be a good way to address mental health in rural areas?
I mean, I don't know a whole lot about mobile health clinics to be able to say the pros and cons necessarily. But I do think that is very similar to this whole community wellness hub with the idea that, well, I don't know. It's a good question. I think yes, anything that we can do to get more providers in our area to kind of pull away from the burnout of the other, providers that are already here is definitely something worth looking into. Absolutely. Do I think that people are going to utilize mobile mental health clinics any more than they would other providers? I don't know. That depends on, how much stigma is in your area, I think. But I would certainly support it personally. I'd support the idea. I think anything that we can do to get more resources around is definitely a good thing, certainly worth a shot anyway.
Any other questions?
I just have a comment. This is Donna Gustafson. I just was saying you're speaking, getting involved with legislative advocacy. I personally, in the rural level, feel there's a strong need to get involved in the local government by way of county board, especially in our rural communities. For those places like mine that has a 708, there's such a need for awareness, and it goes hand in hand with destigmatization as well. So I just want to kind of put that out there, the great need for support for rural areas as far as local government, increased awareness, and the prevention point was really excellent. Thank you.
Absolutely, Donna, and you're spot on. That anything we can do, my comment definitely was kind of a trickle down effect type of an idea with Legislator, but we also have to go the opposite way. We also have to do more in our local levels, because stigma is, I think, one of the biggest problems that we have, really. And so the more we can increase, again, the awareness of what we have to offer in a way that can connect with people. And that's what we have to be important. That's important to remember, that we have to do better of relating to the everyday person. I think a lot of us who work in healthcare or mental health in particular, or behavioral health, we have that hat on all the time. So we can use those big terms, and we can use, we can express why we think it's important. But how can we put ourselves in their shoes, your local board shoes, your 708s, your whatever? How can we put our brains in their brains? Think about how are they perceiving all of this, and how can we make presentations and conversations in a way that they're going to think is more valuable? Great thought, though.
Awesome. Well, thanks so much, Adrienne. And I will, so if you'll send me the PowerPoint slides, if we could have Karen's as well, and we will be sure to send that out along with the link to the archived recording, so folks can share that with their communities. And like I said, it will be posted on our YouTube page, but I'll send the link out. So, but appreciate your time, Adrienne. It's great seeing you again, very informative. And I appreciate everybody who joined us today, and hopefully stay tuned for our next presentation, which will be in January. We have not finalized that, but hopefully we'll get that out to our membership here in the next week or so.
Thank you. The conversation is so important. I appreciate all of you being here and being a part of it.
Thank you. Everybody have a good afternoon. Bye-bye.